on digital transformation in healthcare, managing risk and opportunities, where we will be helping you sharing our thoughts and understanding about how digital disruption is happening on healthcare space and what are the opportunities and risks behind this particular digital transformation. So for today's agenda, it will be introduction for our session. We will be going to introduce our renowned uh, industry leader and speaker. Along with that, we will be covering on digital disruptions, where we will be help you to give better idea on enabling digital transformation and opportunities. Going forward, we will be sharing more about digital transformation, and lastly we will be giving you more insight on cloud and data management, wherein how data management is one of the important aspects in current scenario in order to take the path for digital uh, disruption and transformation. So I'm going to introduce Mr. Ravinderpal Singh to join the conversation. He's one of the senior business leader, having more than 24 years experience in business and technology, understanding the business process, architecture. He was a former ex Dell and Cisco leader. Now he's the CEO for Mercado RHA Private Technologies, and the founder and managing director for GoCuddle Technologies, which is a Dubai-based entity. Um, uh, Mr. Sir, hand over to you.
Hi, thanks, Saurabh, and good afternoon, everyone, to this knowledge session today. I know it's a Friday evening and a very tough time to take out and join such sessions. But I think last 4 months, one of the things which has become a kind of default, or as we call the new normal for all of us, is how do we manage our time and our days during this situation? With everybody working from home, I think the whole aspect or concept of having weekdays or weekends somehow has blurred a bit. I personally, last 4 months, haven't seen whether today it's a Monday or a Saturday and meetings are happening and happening and happening. Anyway, so one of my role, apart from leading business operations for Mercado and GoCuddle, is representing telehealth committee as part of HIMSS Asia Pacific region. And as many of you would know, HIMSS is a global organization around healthcare technology standards and interoperability, and pretty much a very strong organization which works globally in more than 100 countries with local governments, local bodies, to help elevate digital healthcare standards, compliances, and adoption into the society. HIMSS Asia Pacific, with its India chapter, is a very strong team with a lot of senior medical fraternity being part of it, have been working very closely with local business bodies and government ministries for last many years on the importance and criticality of how digital healthcare is going to play a big role. And HIMSS in last couple of weeks have been discussing a lot around digital healthcare in India, which have been there in bits and pieces for last couple of years. And I'll give you a few examples as we go along. But the real test case for digital healthcare happened in last 5 months, when we had an unfortunate situation. We still have it, but thanks to digital health, digital platforms, e-commerce platforms around healthcare, people have been still able to manage somehow their daily routine as far as medical emergencies are concerned. And that prompted us to look at whether this is the right time to talk about digital healthcare opportunities risks, and some associated areas around it. So today we will be covering few of that, and I'll be giving some examples what's happening, and then we'll bring two guest speakers who will talk more about two different use cases, one from a solution perspective and one from a service perspective. So uh, I come from a pure technology background. Last 17 years working in emerging areas, including digital healthcare, whereby too many projects what I have done, one of the project which made me a bit more closer to healthcare was designing the entire digital health exchange for Malaysia government. In 2013, 2014, Malaysia took a big project to put everything into a cloud so that users, patients, doctors, and paramedic staff doesn't really have to be worried about data movements when they go from one place to another or one clinic to another clinic. It got even more better by introducing private, public, and semi-government healthcare providers into the same stream. India has been trying to do it for a couple of years, but the real on ground execution or on ground movement what we saw happened in the last couple of months, and maybe many of you would have seen those news and stories around NDHM, and we'll talk about that. So what we do as a company, Mercado Technology, is to help customers, governments, and organizations adopt digital, whether it is digital health, digital cities, digital manufacturing, digital retail, or digital transportation, digital security, or digital data centers and clouds and everything. And pretty much every new technology what we work with can be summarized into these 4A buckets: automation, augmentative, analytics, and artificial intelligence. That is pretty much what is happening in healthcare too. We have three business go-to markets today. We provide consulting to customers, helping them, as I said, mapping their business challenges to technology and digital. Then we have a platform called GoKadal, which is a digital solutions platform. And one solution from that platform, which is one of the best innovations I have seen in digital healthcare in last few years, will be presenting today. And we have a guest speaker for that. And then the new thing what we have added recently, Data Samudra, one of the innovative data center and cloud hosting services from Bangalore, India itself. And we'll be talking a little bit about that, how that creates a relevance to digital healthcare, what's happening around it. Now, disruption has been happening for last 25 years when it comes to digital disruption, by the way. We are in the third wave of digital disruption. It all started in late 80s, mid 80s to late 80s. And I'm talking more relevance to India, when we saw emergence of introduction of computers in departments, stores, banks, and everywhere. It took some time. It took pretty much 10 years plus for computerization to become a mainstream technology. In early 2000s, we were hit by two things: internet and mobility, or smartphones as we call it. And these two things revolutionize further the way companies work, people connect, patients get access to medical services, and so on. And that was the second wave. Couple of years back, we were hit with the third wave of disruption, where these 4As are becoming mainstream technologies: artificial intelligence, data analytics, automation in every process, and augmentative. And pretty much all these have impacted every industry and every vertical, including healthcare. I'm sure most of you would have seen this movie, beautiful movie, wonderful movie, and I personally liked. Very few movies are made with very good messages, and this was a great message on the education system in the country. But this one scene from this movie was very instrumental in defining how digital technology can improve access to healthcare. I'm sure most of you remember when the character in the movie gets labor pain and there is too much of flooding around with no doctor or paramedic next to it. Thanks to internet, thanks to computing, and thanks to data, the delivery happens. Well, it was a movie, so it was more dramatization. Maybe it doesn't happen in real life like the way they show, but the message is loud and clear. Necessity and emergency is the mother of innovation. Last 5 months, we have seen this happening around us. A lot of innovation, a lot of technologies, a lot of tools, a lot of new things coming into market because of one simple emergency, what hit us, Corona. And that is a fact today, that digital technologies have kept this world alive in last 4 months and is now going to drive the next wave of journey for mankind. And this disruption has just started a couple of years back, and it continues. It continues in every vertical. And let's look at what's happening in healthcare. COVID-19 had a big impact everywhere, including education. National Digital Health Mission, India announced it on 15th of August. This had been awaited for long, because though we have digital healthcare around us, we have systems, solutions, and some innovations for last couple of years, but with the lacking of a body which gives credibility to this, it was not really something which was seen as must have or obligation. If you go to US, you have something called FDA, you get a system approved, you get FDA approved kiosk, and you can say, okay, I have an approval. But in India, when one of my partners went to the government saying, where do you get approval for my kiosk? They said, we don't even know who approves these kind of devices, because there's no body. At last, we have an announcement that National Digital Health Mission is now a reality. Of course, it will take certain more time to come to ground, but at least the ball has set rolling. Digital healthcare will be the new normal, a fact established always. Last 5 months, I know many of them, including myself, whenever we needed medication, we could have gone outside because the local medical shops have always been open. But why should we take a trouble if I can get medicine delivered at my doorstep? I have done it. Not only medicines, but associated ancillaries like BP kit. I wanted a BP kit and I got it delivered. So platforms which are doing it today, not only they started with delivery, but then they started connecting doctors also, because even doctors said, well, except for Corona warriors who have been always in hospitals, and thanks to them, salute to them. There have been many other healthcare professionals who were not right now put on Corona duty, but they somehow could work remotely, and we had app built messaging saying you can get advice from doctor any point of the time. Or we have apps where I can connect to a doctor in video any point of time by setting up an appointment as well. So digital healthcare is the new normal, and government has unveiled a data policy for this. Why? Because when we talk of digital, we always talk of risks associated with it. And I will talk more about what risk we are talking about in this stream. So let's look what's happening globally. Since I partly operate out of Bangalore and out of Dubai, covering almost half of the world. So I looked at both India and what's happening in Middle East, Africa, and related regions. Some of the things which are happening right now. Number one, role of artificial intelligence is becoming more critical, more and more critical, because though we don't doubt doctors and paramedic staff, there have been always chances of errors. When it comes to data, when it comes to use of technology, I think artificial intelligence is making it very, very easy to explore entire data ecosystem, what we have globally, huge, and bring us the right thing what we want. And one example, which of course I cannot talk more about that, but I saw that product. It's called Suki, S-U-K-I. You can Google it. It's a beautiful innovation. How data, voice-related data access by doctors while they are performing in clinics or in operation theaters makes their life much easier, much easier. So AI is becoming another default. A shift in probably many countries. India, I already gave you an example of India. Saudi Arabia announced a big initiative around digital healthcare. Most of the Gulf countries have done it. Now I've seen WHO putting a lot of funds in Africa to create digital missions and digital innovations. So shift in government policy is very important because innovation can only be successful in masses when it is either led or driven by the local health or public authorities. And that is becoming very, very clear now. Diagnostic through multiple solutions. That's also becoming easier now. Earlier, for a video conferencing, for example, you have to go to a nearest center, sit on a desk, have a big screen in front of you. Then we started doing it on mobiles. And now we have kiosks. We have small briefcases with built-in screens, which you can just fold as a briefcase, go to a village, open the briefcase, you have a big screen, you have a 3G, 4G connectivity, and no, you talk to doctor. These solutions are driving mobility in healthcare with greater advantages. Wearables, well, this is one area which is getting a lot of attention and investments. Every other company which was making watches now has started making health devices which you can wear. And it's gone one step ahead, where not only you can measure how much you walked, how much you slept, or how much you jogged, but it's now going much further to actually give an alert when you might have symptoms of heart attack. Or it gives you an alert maybe half an hour before if there is a failure in one of your organs. How? Because of data analytics, which it keeps collecting round the clock. And there's a cloud application which keeps on analyzing that data in real time and telling you what is wrong going to happen. And finally, focus on future. Lots and lots of countries, lots and lots of organizations, both public and private, are putting a lot of investment into blockchain, IoT, robotics, and drones, which have now been started using pretty much in every aspect of healthcare delivery. Last 30 years, as I said, digital disruption is happening. Healthcare, it might have started a bit late because healthcare is a very regulated sector. So any new thing which comes in takes a bit time to start. So let's look at how in a country, I'll take India as an example, and let's see what has changed. If you watch 60s movies, I have never much, because I was born much after that, but I haven't been able to visit a older village today because all our villages have become modernized. But if you watch old movies, 50s, 60s movies, you will see that in villages there were no doctors, maybe local Vaid or Hakim as we call them. And when there is an emergency, bullock carts or local carts will be used to transport patients to the nearest Vaid or Hakim. Doctors were a remote possibility in many of the villages. Only very big villages or villages very close to cities will boast of having access to doctors. And I'm talking about immediately after independence. Then government launched healthcare programs where they said doctors needs to be in villages. They started creating village level dispensaries or public health centers, as we call it today, PHCs. But the problem that they always used to have, even today in many villages, was with one doctor, that to somebody who has been pushed into that village, surrounded by many, many villagers, might not be able to do justice. And there were always reports that patients used to die, they didn't get care at a time. And I'm talking about maybe 70s, 80s, and maybe some villages, remote villages today. But thanks to technology, that scene is changing. Then people started innovating. And this is one innovation which I read and felt very, very proud of how our villagers are using it. Using a mobile ambulance, they call it. Ambulance, small, attached to a bike where a patient can be put inside and taken to a hospital. Beautiful innovation. You don't really need a big ambulance. If you are in a place where there are no roads, at least a bike can go to that place, right? So it's much better than the bullock cart, at least. So these innovations are happening around us. Then healthcare became a big focus for government also, and the government started spending some more. And then we had village level dispensaries. Today we have public health centers, block level hospitals, district level hospitals, and state level hospitals, and then privates. In some villages, you will find actually some doctors going back to villages now, and that is changing the whole dynamics on the ground, and that has now come to technology. So last few years, even both from government and public private side, there has been a lot of push around how IT or technology can redefine healthcare, especially in villages, especially where you don't have a bigger network. You can use 2G, you can use GPRS or maybe a RF link, have VSAT or something, at least connect to doctor, take some first level of consultation. And now we are moving even much farther with those centers. Doesn't even matter. You don't have to go to a center. You can be on a mobile, or you can go to the nearest kiosk where you can just go, touch, and do 30, 40, 50, 60 tests and get a report and talk to doctor. And next level, even get a medicine disbursed from the kiosk. So ultimately, we have come a long way in last 70 years. And today, any village where we have a mobile connection or even a 3G, I think digital healthcare is going to be a very critical aspect of life in next couple of years. So what is driving this technology? Things are happening at a faster rate. We're getting good bandwidth everywhere with 3G, 4G, and now 5G coming in. And people want work to be done much faster, doctors to be accessed faster, data everywhere. So you don't even, sometimes when I get a small health issue, the first thing typically I do is maybe go to internet and do a search, though it's not very safe, let me tell you. So please be very careful if you're doing it, because internet has both prescribed or so-called unauthorized kind of consultation. So you don't have to really depend on that, but at least if you have a medicine at home and you are not sure that last time what was the reason I took it, maybe you can go to net and check, okay, this medicine is used for this, and blah, blah, blah. So at least data is helping now to bring healthcare closer to us. But when I say this, there are also threats coming up. And we'll talk about that because today's topic is opportunity and threat. So opportunities galore, threats also galore, because every coin has two sides and we have to live with that. Now, why digital healthcare is becoming more relevant and faster? Because the time taken to adopt digital is shortening. As I said, first wave of disruption took 10 plus years. Second wave took 3 to 4 years. Third wave is taking a couple of weeks. And you should not be surprised after a couple of years when you get up in the morning and say, hey, I want to talk to a doctor now. Or even before you said I talk to a doctor talks to you saying, boss, last time I gave you a prescription, today is the last day of your medication. How are you feeling? And that's only happening because technology with data is making these things more relevant. So the time taken to adopt technology and digital is reducing, and that is fastening the adoption of digital healthcare everywhere. Last 5 months, this thing has actually catalyzed it. I remember presenting to central government, which is Ministry of Health and Family Welfare, somewhere around March 2019, where we showcased a kiosk-based model, which we will be presenting today, Swayam. And I was talking to the state Minister of State for Health that time, Ms. Patil, and we talked about a lot of things. And she was very excited to see the demonstration. She said, okay, we would like to adopt these things. At that time, the urgency in government was not there. Let me be very candid here. We tried going back to, first of all, the elections came, everything went into a hold. After elections, the new government came, the new people came, government was same, new people came, the ministers got changed. And finally, we started working with them. So things took its own sweet time. But last 5 months, one thing which has helped all of us is the fast tracking of these things because of Corona. So one way this Corona has brought at least some good thing, that many people who were averse to using technology or averse to adopting digital, saying, nothing is going to happen, they realize that anything can happen anytime, so better be prepared. So let's look at what is now happening in future from today onwards. NDHM is already announced, public policies are altered, data protection is in parliament. We're talking about remote health, virtual health. We're talking about touchless systems and everything. So what all is happening around this? How post COVID we are going to see healthcare driven by digital transformation? Where is it happening? First of all, it's happening everywhere in healthcare, whether it is doctor to patient, whether it's doctor to nurses, whether it's within the hospital, outside the hospital, collaboration between doctors, whether it is data in healthcare, whether it is making the whole healthcare building smarter, or it is about tracking the critical resource like a blood bottle tracking. And you have heard news where blood was an organ or a blood was actually taken within few hours by clearing what you call a traffic free corridor with the help of local police and local authorities. So future, you don't have to do it because drones are going to take the blood bottle from hospital A, and within seconds go and drop means go and put it in hospital B. So you don't really have to worry about whether the traffic is there or not. So these things are happening everywhere. So let's look at some of the examples because we cannot cover every example. Healthcare is a huge field, and we have two more showcases. I would like you to look at it. But let's look at what is happening in a couple of these areas like mobility, health cloud, automation, AI, etc. Mobile healthcare. Mobile healthcare is enhancing the entire delivery of healthcare to masses. And that's pretty much simple. You cannot, if you are not able to bring patients to a hospital in a district because of terrain, because of floods, because of lack of transportation or lack of even roads, why don't take the doctor there? How? Mobility. Either you take it through a computer, through an app, through a video conferencing, or put it in a briefcase, the entire logistics, and take it to a village. And these things are happening today. And it's increasing efficiencies. Look at this: time efficiency, improved communication. And this is a result of a survey done by Met Data Group a couple of years back. So mobile healthcare has been proven to be a very effective medium of delivering healthcare to masses. Not only around doctors seeing a patient, but also prescribing medicine, exchanging results, test results, or imaging like X-rays or ultrasound, and keeping health records safely and accessible to right people, and telemedicine technologies. So mobile healthcare is enhancing and making it even much better. And this trend continues even today. Mobile healthcare is also making the role of doctor pervasive, which means you don't have to really think whether I go to a clinic and will I get a doctor there. No, if you are using telehealth, it doesn't matter. Doctor can be stuck in lockdown somewhere. Doctor can be, or patient can be stuck in a flood somewhere. The only thing you need is a small internet connection, whether it's on your mobile 3G, 4G, and you do a video conferencing directly from your app or a kiosk or a laptop or a PC or whatever way. And this is being driven by Internet of Things, where the devices are talking to each other. And we'll showcase one such solution today. So mobile healthcare, why it became even more prevalent? Because the normal healthcare had some challenges. One of the biggest challenge I've seen in countries like India's budgets. Means you can't expect government to put a hospital in every village because it requires money. And spending wise, we may not be the best spenders in terms of GDP, yes, but at least whatever government is trying to spend, we cannot fulfill all these things into that. So that means the private public partnership becomes even more important. So mobile healthcare and mobility in healthcare got a big boost because of these challenges and concerns what we had seen in our traditional healthcare. Wearables. Now, wearables are redefining the way we live. Yeah, I shouldn't be wrong if I say this. Redefining the way we live. People are getting more conscious. Maybe in some cases overconscious. That's a difficult thing. But wearing a wearable which can not only tell you what you eat, what you live, how do you walk, but also give you a predictive alert, say half an hour, 1 hour before, saying, hey boss, I noticed your heartbeat is irregular. It might be a sign of heart attack. Better check. Because most of the time, heart attack patients, they just collapse because there are no signs. They might get signs which they ignore. They don't know. Getting sweating. They might say, "Oh, it's too hot, so I'm being sweat." Or getting a bit of palpitations, or sometimes they say the heart attack. One of the symptom of upcoming heart attack is that you will feel numbness in your hands. But sometimes what we feel is, oh, numbness because I was lying down for on this side, like in India we say, and my hand was below my head, so maybe that's why my hand is numb. But maybe these are the symptoms body is telling you, but you're not able to identify. Now what we're doing is giving that job to a technology, app inside your mobile, connected with Bluetooth to your this device, and getting data and then analyzing the data around the clock, and then saying, "Oh, boss, I got something which might be a problem. If it may not be, but it's better to go and check." Because these are life-threatening scenarios. So wearables are becoming more and more pervasive. Another things which are happening around us: drones everywhere. Drones carrying blood, drones carrying critical organs. It started happening with drone policy coming, I think last year, then licensing coming up, and now companies around us. You got drones everywhere. You just need to know, a number and call them. Hey, I need a drone service. I need to carry this to this, and whatever are the compliances, regulations, standards, they are being worked upon round the clock right now. So drones are going to play a big role in delivering healthcare to masses. Robotics. Robots are in your operation theater now. Robots are in patient care. Robots are in elder care. Robots are in hospitals and outside hospitals, because you cannot rely upon a human being 24 hours a day, because every human being uh, needs rest. So robots can work much longer with precision, and that is why it's becoming more and more relevant for robots to enter healthcare streams. Virtual reality. No, this is very, very effective. I met a company. I wish I could have got them today, maybe next time, who made a beautiful model of human body in such a minute detail that when you wear glasses and using that application, you feel that you're actually inside the body. I've experienced it myself. You're standing inside a human body, and you move around, you see, okay, on my left, there's a heart and it's beating actually. On my right, there's the lungs, there's a kidney, there's the brain, and you can actually virtually touch them. And then where can you use? When doctors are being trained. Today, when doctors are being trained, they have to open a body or top, a dead body, which might be decayed already, but may not be 100% exactly. They can see each nerve and each vein. But when you use virtual reality, you stand and say, okay, are you seeing this vein? Yes. If you hold this vein, the blood will stop and heart will start palpitating. That can be shown as a scenario right there without a body, thanks to technology. And finally, data-driven artificial intelligence, which is making healthcare delivery to the fingertips. No longer looking at books, no longer going and referring to encyclopedias of healthcare, just command. And that's where Suki, a beautiful product I've seen, comes in. It's on your table. It's like Amazon Echo. You tell him, Suki, can you tell me if kidney has this, what can be the possible reason? And Suki will talk to you. Suki will say, as per the data we have, it can be this. And doctor he doesn't have to open a book, go outside the room and all those kind of things. And these things are happening all around us. These are not something which is going to come. These are right now happening around us. Another one example I would like to give you, because I was associated here, so I feel always proud to be part of certain beautiful projects. So in 2015-16, my previous company, Dell, uh, and Tata Trust worked together to provide a beautiful platform to government of Andhra Pradesh. And they used to call it MMHC, which was actually for women around the state who didn't know they have a problem, because the mortality rate during labor was very high, and there were ASHA workers. So what they decided, that if we can have ASHA worker capture every time they visit a village, They can capture those 2 3 parameters. When was the last vaccination you did? And like ladies, when do they have periods, and all those things. And that data goes to a cloud application which was developed by Dell, and that application creates beautiful visualization of every data, which goes to the nearest government official, like the healthcare official, as well as a copy of that goes and being displayed in the central command control center in the CM office. So within few months, they could actually track every pregnant lady in the state, and they had entire data given to the ASHA worker that the lady in your under your village tomorrow she needs a vaccination, or the child which was born few days back tomorrow is the immunization he needs. So it became very easy for both ASHA workers, government officials, and patients to remember, get the right time, right dose at the right time, and know where is the problem. And within a couple of years, by 2018 and 2018, when Government of India launched Ayushman Bharat, this was actually talked about as a case study. But this state and many states did after that. This was one of the first I saw, and I was closely involved here. So beautiful thing. And this is an example how use of technology in public healthcare is driving innovation. But when I talk about all this, there is bound to look at risks and concerns. Today, we are looking at risks and concerns in every aspect of healthcare. Standardization. We said, okay, digital healthcare is a reality. We are bringing kiosks, we are bringing wearables. What about standardization? Everybody can create a wearable which can detect a temperature, but is it really accurate? How do you know? Earlier, the problem was we didn't have a body where I can take my wearable and say, you know what, please check it and give me a certificate. The only thing what technology was doing was, number one, electronic certification, like you have CE, or in India, you have a quality certifications like BIS standards. Okay, this device is BIS certified, or this device, but that was not a healthcare certification. That was more about the functioning of the device, or the radiations, or the electronic way, working of the device, right? So India didn't had a body like FDA kind, which would take a kiosk, check, and then give a certificate. Okay, this kiosk can give you results which are within the prescribed limits. There was no body. At least now we are going there. So standardization and certification of devices. Till now, we used to look buy a device which is FDA approved or something approved. So that is now becoming a reality. So that risk will be taken care of. Data privacy, of course, this is another big thing. Data, especially in healthcare, is very critical. Healthcare data sharing is a critical offense also, legally as well. But how do we manage that? Again, data protection laws, which are now coming, both healthcare protection as well as non-healthcare, will make it much, much easier for people to redefine how they are keeping the data, storing the data, and using the data. We just got a draft from central government. It's in the public domain. You can have a look at it. I think there are a few days where government wanted public to give their recommendations, inputs, or feedback. It's called NDHM, National Digital Health Data Privacy Draft Guidelines. You can see it on Google. And that talks about what data privacy things or data protection things they want to inbuilt into these systems. Control and administration of system is another big challenge. Somebody asked me when we were showcasing one of the solutions, saying, you bring a solution, who is authorizing you to bring a solution? Well, if any company today creates a medicine, you have to go to ministry, you have to go to a body, get it approved, and only then you can sell in the market. But we didn't have that for devices, as I said. But at least now we know where to go, how to control. The best we could do till now, I've seen many startups struggling here. Go to a local hospital or catch hold of a good doctor, tell him, sir, why don't you test my system and give me a letter saying, I have tested it, I found it very relevant. Now, that is very subjective, but that had its own pain. Then the hospital saying, okay, give me a machine, keep it here for 5 days, and I will check it and then tell you whether it's good or not. In some cases, it was more like an exploitation of startups. And I have personally seen that happening with one or two organizations. But no choice. You had no choice. At least now you know where to get the control of this whole thing. Cybersecurity, ransomware is a big thing. It happened in one of the hospitals. I don't remember the place in India where they put entire data at stake and said, until you pay me this, I will not release the data, which was a healthcare data. Again, it goes back to data privacy and control and administration. If we tackle these two things, we are able to manage risk. Risk is continuous. I'm not saying that you can have 0% risk stage. Nowhere. But it's a continuous process, both sides. The medical devices, systems, and technologies, they are putting lots and lots of efforts and investments into making security a very prominent thing. At the same time, governments and bodies who are responsible to manage and control the entire cyber thing, they are putting a lot of efforts in this. Reporting concerns, again, if you go to a kiosk, get a report, who is signing that? Yes, so that means the person who is managing that kiosk-based service or an app-based service needs to actually have a pathology guy to approve and authorize that report. And those guidelines are already there. So I think better, we need to just make sure that we adopt to those guidelines. Again, test accuracy is in the simulation, calibration of devices. There are guidelines, and better, the best way we can do is to adopt those guidelines and make it a part of the entire digital life cycle thing. Patient digital literacy, of course, we cannot expect every patient who comes to a kiosk to manage the kiosk himself. But the way these kiosks should be made, where the software should be made, especially like you should have a local language, for example. In villages, you cannot expect everybody to know English or Hindi everywhere. So can I have a kiosk in a Karnataka village where person can go and the kiosk can speak to him in Kannada and tell him, you know what, take this, go there, do this, and hey, here's your report. If we can do that, I think, and companies, I know many startups whom I worked with, they're actually doing it right now. So opportunities are there, risks and concerns are there. The good thing is we are now looking at all the three bodies, the government, the public and private organizations, and technology providers working in tandem. Earlier, it was not there. Now, thanks to this whole digital healthcare programs, we are coming together and making digital healthcare much easier, much safer, and much flexible for people to adopt and use. And this is the only way we can drive healthcare to masses. Otherwise, physical healthcare in every place, every time, round the clock, is virtually and practically not possible in countries like India with so much of difficult terrain, budgets, and all those local cultural and language barriers. It's not that easier. So technology can make it happen, and technology is making it happen. So I think I would stop this at here and then go into two different things. One is, let's take one example. Since I said it's already there, it's happening, let's look at how one solution, as an example today, is transforming and disrupting the healthcare industry. There are many solutions, but we can't talk about every, but I'll just take one right now. And I will invite one of my partners, friend, and part of my own team, Preetam Kumawat. He's the founder and CEO of Sanskritech, which is a startup in digital healthcare space. And few years back, he and his team pioneered an innovative concept called Swayam, which is, as you know, Swayam means self. So a kiosk-based model, where you can do any kind of test, doctor consultation, reporting, etc., etc. So Preetam has been working in medical industry or healthcare industry for many, many years. Before this, he was head of a small medical company in Mumbai called Medicheck Health Systems. And Preetam and his beautiful team has innovated something which caught my attention around 3 years back. Then I worked very closely with them to make it possible that, and we tied up with Dell also and a couple of other organizations to bring it to market. Again, as I said, the NDHM was not there. Many people started asking questions: who has approved it? Who is going to standardize it? At last, now we are seeing light of the day, and that's becoming. So I would request Preetam, if you can just share for next 15 minutes on how you are transforming and revolutionizing healthcare with your innovation. And Saurabh, if you can pass host to Preetham, or Preetham is already.
Yes, I have already done that.
Okay, okay, Preetham. Please go ahead.
Okay, thank you, Mr. Ravinder, for such a great insight, and thank you for throwing light on the the latest trend and technologies happening in the healthcare industry as well as other industries. And also thank you for having me here. Hello everyone. Very good evening, and myself Preetham Kumawat, and I'm one of the founder of Sanskritic Smart Solutions Private Limited. This is a basically health tech company, and we have a solution called Swayam Health Monitoring System. So I'm just going to share my screen. One moment. Okay, I hope everyone can see this screen.
Yeah, yeah.
Oh, okay, great. So I'll just give you a quick information or the background about me and my team. This company was founded by myself and my co-founder Trupti. We both have the experience in the healthcare industry as well as the diagnostic industry since 2013 and 14. So in the previous company, actually, we used to conduct camps and we used to provide services to corporate industries as well as pan India. And while doing all these activities, one of the major thing which we observe, and I'm sure most of you have already observed that the access to basic healthcare is major problem in India. Now, whether it's Indian government or private players, they all are spending huge amount on the healthcare, and we have best of doctors, best of technology available in India. But still, the state of health, whether it's a rural part or whether it's urban area, like state of health is going down day by day. And the reason is what we identified is a majority of expenditure or majority of funds are actually happening on the treatments rather than the prevention. And because of that, any simple or any small disease or any small symptoms which actually converts into severeness because there is no early diagnosis. And this is where we decided to address this issue. And this is where we saw the big opportunity also and something to do for the society as well. And in around 2015-16, the entire industry actually was transforming. The digitization, what we are calling, many apps were introduced, and many technology products were introduced in the healthcare as well. Uh, but the best example what we had in our in front of us is a banking industry. If you all remember, like just 15, 20 years or maybe 20, 25 years, when ATMs were not part of the banking industry, and it was very difficult for the bank as well as the user to do banking transactions. Like if any banks want to set up a branch in any particular city or town or village, they had to spend a lot of money for the infrastructure, for the manpower, for the systems and everything, as well as there were limitations for the timing as well. So user used to face a lot of difficulties even if they have to withdraw some basic, even if they have to do some basic transactions. So they had to wait for the bank to open, and when the actually banking ATMs introduced, and now we know we can do maximum things through the ATMs, and we actually don't have to visit the bank. And banks also could establish themselves everywhere, every corner of the India, or whether it's a village or city, everywhere. So we had this best example, and we thought, why not bring something like this in the healthcare where people can just walk in, do their basic test, do the preventive test, get in touch with the doctor who is sitting far away without spending much money and time, and get the early diagnosis, which can actually save the lives of millions. And this was the idea, and this is where, like somewhere in 2016, we actually started working on it. So I'm just moving to the next slide. This is about the company, who we are, the vision and the mission, and we have also won 2 awards for the solution innovation in healthcare category. So these are the challenges what we I just mentioned, that lack of there is no early diagnosis where or there are no facilities where we can get early diagnosis and prevent any diseases to become a very severe. So there are a couple of reasons, like there are lack of affordable healthcare services, and there is lack of infrastructure, lack of manpower, trained manpower. If you see in the rural side, you don't even find MBBS doctors. So even the most of the government health centers have just paramedic staff, and they don't even have the medicines facilities. So suppose if somebody is not feeling well in the village side, they have to travel all the way to the district place just to get the basic diagnosis. Forget about the treatment, and they have to spend a lot of money and time. So something we were just thinking of some solution where people don't have to travel so far to get the basic prevention or preventive test or basic diagnosis. So in the 2018, we actually came up with the solution called Swayam. Now Swayam means, already Ravinder sir has explained. The Swayam means on your own or self, and this is basically a Sanskrit word, and it just reflects to the concept of the solution. And what is Swayam? Swayam is basically a portable diagnostic and a telemedicine kiosk which is developed in India by the team which we have right now here, and it has almost 60 plus test parameters. So the concept is, the idea is you just walk in, do your health checkup, do get the reports, do video consultation with the doctors if required, get the instant prescription. You can access your reports through your mobile app or even the web access. Even the real-time data analytics is possible in case of corporates and government. So what are the key features? The key features are, like, till now we have integrated 60 plus diagnostic tests where you can get the instant report, like tests like HbA1c, for not only tests like sugar, glucose, or hemoglobin, lipid profile, but there are also high profile tests, cardiac test, and many other tests, ECG, where you can get the report instantly and as accurate as you get in the lab. So we almost have 90 to 95% accuracy in every test report, and those reports have been validated by the reputed labs as well as the FDA authorities. So there are third-party devices which we have integrated in the system. Those are US FDA approved. You can get the report either through print, where the printer is already attached with the system. You can email it to yourself or any doctor, or also you can access the reports through your app. Televideo consultation. Now, telemedicine is actually not it's not a new technology or something. People have been practicing telemedicine since long time, and definitely in last couple of months or years, the percentage has increased. Now, even on WhatsApp call, you can get in touch with the doctor, but at the same time, doctor cannot give you diagnosis beyond certain limit unless and until they see your reports. So even the telemedicine, even though it was available, but it was something like a 50% of the solution, not the 100%. So it wasn't completing the complete healthcare ecosystem where you can get the early diagnosis. So this is where the Swayam has both. It's a combination of instant preventive pathology as well as telemedicine platform also. So right now we can do telemedicine or the video consultation with doctor with 4 cameras. There are 4 cameras attached with the system: touchscreen cam, webcam, dermoscope, otoscope. Even the 12-lead ECG and the stethoscope is attached with the system. Now the pricing factor, because the test pricing in the rural or urban, like, it's a main concern for everyone. Like, most of the time we have to, whenever we visit the pathology labs or any particular place where we have to spend a lot of time and a lot of money also. So at least for basic preventive tests where we can spend minimum time and with the minimum price what we are paying here. So we are providing also consumables at very discounted rates to the partners or the uh, people who are actually going to manage the kiosk. As I mentioned, you can access reports through web, because this is a totally web-based solution, and all reports are saved in this server, which you can access from anytime, anywhere. Now, how does it help? It actually helps to reduce the capital expenditure or the operational expenditure for the government as well as the private players. It adds the convenience. These are the test parameters which we have already integrated in the system. I'm sure after this webinar, Ravinder sir can, anyone required to have more details about it, they can share the details with you. Now, Ravinder sir was explaining about the National Digital Health Mission, and few years back, actually, we had thought about this, and definitely when we shared this concept with Ravinder sir, actually we were discussing how we can help government by reducing the capex and opex also, and at the same time provide the best of healthcare services and the data, which will be beneficial for the end user as well as the government who can get the data and who can form policies in a better way. Also, it will help them to execute. Thankful to Prime Minister Modi ji. Actually, he has already given a kind of approval for this digitization in the healthcare industry. Like till now, we were just moving ahead with the conventional method. Now, the good news, the good part of this is like now the digitization is widely acceptable. And whatever Prime Minister Modi has explained about the National Digital Health Mission and its features, we already have in single solution or in a single kiosk. For example, the digital healthcare ecosystem, Health ID, which is already part of the kiosk. Health records are saved in the cloud. And as Ravinder sir also was mentioning about the security of data. So all data is encrypted. Other than you, no one can access your healthcare records, not even us as a master admin. So all data is encrypted. Now, the DigiDoctor, one of the main features is of the digital health ecosystem, which we already have, and the health facility registry that is also part of the system. Later stage, they are planning to have e-pharmacy and telemedicine on a grand scale, which e-pharmacy is also, we have a platform where we have a partner where we can just link our solution with their apps or something. And the moment we prescription is generated through our system, that can be linked to their server, and we can order pharmacy or pharma products or any medicines from this kiosk itself. One of the feature of digital health mission is app and website, which we already have. Even the user can access their reports through the app. Let's move to the next slide. Now, the social impact of Swayam. The objective of, if I have to summarize everything in one line, what we are trying to do is create an easy access for basic healthcare at affordable cost. So this is one of the key point, because the easy healthcare access, even in urban area, if somebody is not feeling well, they have to visit the doctor and you have to wait in the queue. And even if doctor suggests you some to do basic preventive pathology test, you have to visit the pathology center and they will collect your sample, and you may have to wait another 24 hours to just to get the basic reports. So here we are trying to increase the clock speed, and by giving reports in just a couple of minutes by using point of care devices. So this is the first mission, is like creating an easy healthcare access for everyone. Another aspect of every kiosk needs one attendant, and it is directly giving employment to one unemployed person. Also, there is a possibility, or there's a opportunity for the self-employment. If somebody wants to take the kiosk, buy the kiosk and start the business, whether it's a urban side or rural side, that is also possible. Now we are doing PPP model with government for even the National Digital Health Mission, as well as there are a couple of state government where they do not have budgets, and but at the same time they have willingness to create wellness or healthcare facilities at the grassroots level.
Pritham, you have 5 more minutes.
Yes. Okay. I'm just a couple of two slides.
Sh-
Okay. So before this pandemic, as Ravinder said, in last 5 months, many things have changed, and definitely in this unfortunate situation, there are good sides also. Now, people have taken health very seriously. They are very conscious. If you remember, 5 months back, nobody was even aware of what is SpO2 or what is pulse oximeter or oxygen saturation. Now, the good part is everybody wants to know the temperature of their body, or what is the oxygen saturation, or what is their pulse. So that's a good sign, and people are very conscious about it. And now they are focusing on this something called preventive and immunity boosting rather than just waiting to something to happen and treat it. Now the applicable areas, fortunately, this solution has applicable. This can be applicable everywhere. Whether it's not only limited to hospitals or something. It can go everywhere. Whether it's a rural healthcare center, petrol pumps, highway, even the corporate offices, airports, where people can. This is just like it looks like a bank ATM where you can just go. How you would go and withdraw money, you can just go stand in front of the kiosk, do a couple of tests, get the test report done, and move out quickly. These are the few awards and recognitions what we have got recently for the innovation in healthcare. This is we are also present on social media on everywhere, whether it's a Twitter, YouTube, or Facebook, LinkedIn, and Instagram. So this is it. Anyone has questions, they can get back to us or Mr. Ravinder and team, and I'll be happy to answer you all. And thank you, Mr. Ravinder and Marketo team, for being there and giving us support throughout.
Thanks, Pritam. And this is one innovation I always think very high of, because it is creating a very easy way for people who are in the bottom of the pyramid to access quality healthcare. It's been an area which has always been very tough and difficult for all of us. So thanks, Pritam, and
Yeah.
of course we will have a small question answer session at the end. Let's now go back to another thing which we talk about. Pritam, can you remove? Okay, 1 second. Yeah, okay, done. Okay, now when we talk of digital healthcare transformation, the opportunities, digital healthcare risks, and looked at one solution from healthcare, core healthcare solution on how it is redefining. The other part which was there, so that is more of opportunity. Now let's talk about risk, concern, and how to manage that. Data in healthcare, security in healthcare, privacy in healthcare has been a big concern for everyone. Thanks to all the regulations around, thanks to what I mentioned a few minutes back around data security now becoming a built-in feature in these devices, things are becoming easier. But tomorrow, when data becomes even more prominent, because digital healthcare is going to be bigger, and you're going to generate a hell lot of data in every clinic, every hospital, every mobile kiosk, everywhere, then how do you safeguard this data? How do you safeguard all the applications? Where do you keep them? And the first thing which always comes to our mind is cloud. With Corona pandemic, cloud is becoming like the new way, new normal to work and deliver any solution. And when we talk of cloud, the first thing we should look at is, where do we host this? Data Samudra, a very new innovation in data center industry, which is redefining the way data is hosted, data is secured, and data is backed up. Data Samudra is revolutionizing the whole concept of cloud data hosting. And for that matter, for healthcare transformation, this becomes a very critical partner, very critical aspect. And today, when we talk about how Data Samudra is going to help us, I would like to invite Mr. Mantesh Kastur, Managing Director of Tele India Networks Private Limited. Tele India is the company which is setting up Data Samudra, the new innovative data center in Bangalore. It is very close to Bangalore International Airport, and we'll give you some more highlights about why this data center is poised to tackle the growing concern around data and hosting in healthcare. So for that, Mr. Mantesh, I would request you to share some background about how this idea of setting up this data center came up, some background about what Tele India does, and then we will go into some features what the data center provides, especially in the healthcare side. Over to you, Mantesh.
Thanks, Ravinder, for detailed in-depth on healthcare and even on the data Samudra's piece. Uh, as we discussed starting from this discussion, so I think this data centers are going to be kind of a heart of the data security and innovations and other aspects. So definitely, when we look for data center, it is a huge investment stuff, and it needs a lot of infra, in fact, and technological stuff to adopt in order to support these innovative idea which comes in. So that's where I think the Tele India networks is being able to take to go along with the technology what it grows. So just to give a brief about the Tele India, it's a group of company where it's founded in 2006 in Bangalore, and basically we started with the service provider business unit, and then proven experience and the quality standard and efficient delivery process. So we making it a reliable partner for especially our new digital area and reshaping the future of people, nations, and business. So more or less, we beginning Tele India was more focused on customer like OEMs as service providers and service bundled as a package and the concepts. So overall, our target was achieving to maximum value and giving end-to-end services. So especially it was proven with the networking area where Tele India Networks was more or less covering all kind of network related stuff, having more than 900 professional working across India, UAE, and Singapore. And we serve our clients end-to-end customer in India. Most of them are in APJC and Europe region. And we have very good customer base working with Ciena, Cisco, Nokia, Adva, and even ASN, and even Vodafone India, Geo. So likewise. So, and we have kind of a deploying data centers and the main key expertise on even the SDN technology and SD-WAN and NFVs. So we have been doing already with Tele India Networks. So which considering to work with the field engineering, project engineering, equipment installations, configuration, traffic integrations, and even test and turn up. So we are really handling exactly the core engineering stuff which finally delivered with these innovative solution across all the corners. So it's at the SP side or probably even on the enterprise side. Yes, we have all those experience, and then we. So I think we started looking at expanding our business, wherein we started looking at building a new concept and the new technology to work on. The data center was the one key stuff which we really took initiative in last 5 years back, and we started building up. And I just wanted to brief what is the data samudra. So the data samudra is one of the first on-demand and requirement data center providing co-location hosting and cloud services. See, when we look at for any kind of data center aspects, there are a couple of investments are very more important when it comes to the health segments are probably on data security and management technology, and even collaboration and communication technology. Today, the communication is becoming a key in order to take with the remote calls, and even the school and colleges are effectively step up in using those technology tools and virtual working technology tools and efficient compute and even cloud compute. So these are the ones which we are already started. I think our premise is already ready for even on that, and we started getting the customers and all this stuff. So we built this data center having almost 500 rack size. So in fact, in order to cope up and covered with data center related offering. So the present demand is moving away from traditional methodology and technology of the data center, more agile and dynamic data centers. So this actually pushes to optimize the space, energy, resource, and technology. So that's where we are saying is a cloud data center, which brings all these agile stuff, which could support in having IT as a services, and which brings in with the flexibility and demand and as required. So definitely there are different package offerings which packs into it, and then the pre-packaged offerings, and access controlled and secure access. So the private and the public clouds are more important aspects here, and including the warehousing to data in mobility, and even the health segments if comes in. So without the data, definitely it's not going to analyze any kind of analytics. So that's the one stuff. So we focused to give a better services, considering the key benefits as flexibility, on demand, and as required. So one aspects of the flexibility is that so we provide as a bundled stuff on the durational basis and the price models and the space aspects. So I mean these services are really as bundled, and we are very flexible in on the computing the rates and other aspects. So when we look on the demand services, definitely this is very most important where the infra waste is definitely is going to be a consideration in this, and we provide to have the proper networking and security aspects to provide. So we are trying to bring here pay as you use rather than just keeping the hardware to bill for completely. So the our service definitely will bring as past services. So and and maybe that our offerings looks to be from application layer where it start with different containers, virtualization. So even on the software defined compute and network and infrastructure supply area. So on the example on the co-location, so these services likes to be as a space as a service, and even private suites, and even rack and space, especially when somebody is looks to take only the real estate piece. So it's that's the one. And the cloud as a services, definitely there are so many services, even DR as a services. So and also the hosting aspects. So we would be offering these services to variety of customers and focusing even SME to even the big player. So today there is a lot of startup companies coming, so they can even start using our data center as a one-stop solutions, which they can bring, including incubation center and flexi tables to work in. So when we look at today with the COVID situation, there are certain IT challenges which we see, which needs more automation, which in order to have the data center transformational piece. So which needs really a secure segmentations, which brings definitely compliance and the governance and all this stuff. So our data center gives the tier 3 certifications, which really covers these piece. And with the uh, cloud experience, so there is a rapid deployment of infrastructure for a new tenants, and even with the multi vendor support and policy based automation. So the automation piece with the cloud is going to be the new innovative solutions and other aspects, because now everybody is used to the latest technology. So that's of course it is required to build on the automation stuff, and everything is become application driven, and it's going to be very user friendly stuff, and where application has to look on agility and the complexity, and more or less it has to be user friendly applications to deliver and use it. And even performance also it's matter in fact to uh, give the latency and etc. And mainly the cost aspects, which is the data center definitely will give you the better TCO and ROI for our customer who really comes in here. Yeah, so when we talk about the data center facilities and the key future features, so there is going to be the mainly in the floor area, which we cater to built upon around 19,000 square feet premise space, and which covers almost 500 racks to support colo hosting and cloud services. And the power grid, power aspects, we have two separate dedicated power lights coming from different station to have N plus one support, which includes the N plus one DC configuration, N plus N UPS backup, and average cabinet loads which range from 5 to 15 kilowatt. So on the cooling aspects, we do have air-cooled chiller with N+1 configurations with support for keeping the cooling technology connected. And physical securities are well covered with a 5 level of protection access control, which includes door alarm, CCTV, and even the gas suppression control panels, which also considered remote interface and uh, other security systems. And we have taken care to cover all the passive stuff, which could be the fire resistance cabling system and rise floor aspects, which in order to keep the data guidelines, especially in the fiber and copper. And cybersecurity aspects, we covered with ISO 27001 certified facility, and even secure perimeter and traffic and other aspects, even point-to-point secure channels. And when it comes to networking, we are uh, getting the IP1 license in a month or so, and which really help us in even renting out the space and other aspects. And we have scalable network and including the SDN technology and the staging and readiness room as well marked in the stuff and vendors. So there's another stuff would be required on the same premise and the one-stop solution, as I said before. So the Global Network Operations Center covers to monitor all kind of network elements or any monitoring system. So which could built up with different concepts and innovation, and which is part of state-of-art use, which uses latest technology and tool. And then this can be even having with around 30 to 40 seating capacity and monitor with even the bigger network, which is fully compliant with the ITIL process and highly secured NOC with the 4 level of security access. So this is about Data Samudra and
Yeah.
uh,
Thanks,
yes,
Mantesh.
Ravinder.
Yeah, so since we are talking about data samudra, so it's very pertinent to give a glimpse of what cloud is doing in this space. So when we talk of cloud today in every vertical, uh, it's envisaged as a stop where I can put my software applications and get them delivered. With healthcare transformation now more real than it was, and healthcare applications from all aspects, what we just saw a few minutes back around mobility, around AR, VR, AI, blockchain, security, cyber, etc. There are plethora of applications generating data sitting on cloud across the world. Now, what happens when you talk of end-to-end service management or end-to-end solution aspect? It makes sense that you talk about a place where you can go and get all these services delivered. There's no point getting to point A for my ERP in healthcare, or HIS as we call it, then go to point B and try to get a wearable mobile application, and go to point C for kiosk available application and all those. So what we felt is that the time has come in healthcare industry to look at a consolidated vertical focused cloud. Vertical focused clouds are becoming increasingly relevant with the IBMs, Microsofts, and Amazons driving them more from an IT enterprise perspective. So today you go to AWS or Azure or IBM cloud, and you can get ERP systems for IT, CRM, SCM, supply chain management, and all those. So they are enterprise applications. But when we talk of verticals, industry verticals, and today we're talking about healthcare, where do we go? We don't go anywhere, because if I need HIS, I go to point A. I need tracking in a hospital, then I go to point B, likewise. So we felt that since we have a cloud hosting data center built in Bangalore, Data Samudra, we have applications like Swayam, which we just showed a glimpse, and there are many of them available. Then we have cloud omnipresent, and we have GoKadal, which is world's first digital solutions cloud exchange platform we felt that the time has come for industry to look at vertical cloud. And one of the such first vertical cloud we have started building on and is in healthcare. We call it health vikas. Now vikas, you can take it as a Hindi word vikas, which is development, but in technology sense, vikas stands for vertical cloud as a service, a cloud where you can go and get end-to-end life cycle applications from healthcare perspective, starting with patient monitoring, user registration, doctor consultation, doctor appointments. Now, we are not going to create those applications. Let me be very clear, because neither Data Samudra nor Gokadal nor Swayam is in the business of creating everything. There are a lot of players. So what we are trying to build is a vertical cloud called Health Vikas, which will have life cycle end-to-end applications from multiple vendors. And it gives even more flexibility to customer that if there are sorry, so if there are four, oh God, somebody is talking loud. There are four, say, patient monitoring applications for end customer, for a hospital or health provider. It becomes easier that instead of going to four places, you can come to one place, look at all those four and say, you know what, I want service number C. It looks very relevant and cost effective for me. I would like to avail this service, and it gets delivered to him through the cloud. So cloud will be hosted in Data Samudra with all the data security, and since NDHM is allowed, once we are close to completion of this, we would definitely like to go and get it certified, so that there are no ambiguities in terms of compliances and standardization. Second, then we have applications like Swayam, where you have a hardware part provided by the respective partner, and application and data getting delivered directly from Health Vikas Cloud. So in short, Health Vikas is going to become a one-stop shop for all your healthcare application needs or digital healthcare needs. And this is very relevant today because the journey for digital healthcare is now in its growth phase. It was in infancy for a couple of years. Now it's going into a growth phase. And in a couple of years, maybe 3 years later, 4 years, we would have all these applications as part of our daily routine. So Health Vikas, stay tuned for it. We'll have a separate session someday once we reach closer to creation and opening of it. We will share more details about how Health Vikas is going to change. And this is being built our Data Samudra platform, which is in Bangalore, enabled by Gokadal, and a host of our application providers from India and global. So we'll share you more details as we go along and progress on this, and happy to have another dedicated sessions on this side. Now, with the opportunities clear, risks we can manage, mitigate, then what is left? Digital adoption. How do we do it? Number one, you need a partner. You have Mercado, which is digital transformation partner for healthcare. You have solutions like Swayam, which we just shown as a solution. Then you have cloud, which we are building, and you have Data Samudra, where you can host, co-locate, and put your applications to be delivered directly from the cloud. Because we want to give an experience to our customers in healthcare industry, be it a hospital, be it a healthcare service provider, be it a private enterprise offering healthcare applications, or be it a government and public sector offering multiple health services to citizens. So we would like to become part of each of these areas with our customers, partnering with them. And for that matter, we are here to make sure that you know where we operate, what we do. And today we gave you a glimpse. And now, Saurabh, back to you.
Thank you so much, sir, for this lovely session. So, back to the participants. Do you have any questions so that we can answer for you?
Yeah, at the outset, all the speakers gave us a lot of knowledge. I have two questions. One is for the Swayam. There is a standard of personal health monitoring equipment compliance from IEEE, that is IEEE 11073. And this I am aware because medical electronics related work we do along with some standards organization. So if Swayam wanted to also look at how IEEE 11073 suits to their requirements, we can do some bridge work there with the standards directors. And for the data Samudra, I have also a solution that I can offer. Bridge with the ITI data cloud, where they are part of the National Internet Exchange of India,
Mhm.
whereby you would be able to route the data of India to Indian infrastructures. So these two things I can offer as my
Sure,
suggestion.
Kishore. We'll have an offline discussion. Thanks for that, because both are very, very relevant,
Sure,
and we'll touch base offline on this.
sure.
Okay. Thanks for that.
Thank you so much, Mr. Kishore. Apart from Mr. Kishore, anyone has any queries?
So, Saurabh, you will be sending an email to everyone.
Yes, I'll be sharing this PPT deck so that like they can have a better perspective what we are actually trying to do.
Okay.
And yeah, I'll certainly
Fine.
share it.
Then we can close it, I think.
Okay. Thank you so much for joining this knowledge session. We will certainly be in touch, and if you have any queries, please do reach out to us. We will
Thank you.
love to help you with the query.
Thanks,
Thank you.
guys. Thank
Thank you
you.
so
Thanks,
much.
Thank you.
everyone.
Thank you. Bye bye.
Thanks for your time.
Have a great day.
Thank you.
Thanks, sir.
Thank you.